Hello everyone and welcome back to the 16th episode of the Diary of an Endodontist. Today we'll be talking about another interesting case of trauma, so stay with me. This young lady was referred to us. She had an accident at school and she knocked the lower right one. As you can see here, there was periradicular radiolucency. When the dentist sent it to us, he did a sinus tract with a GP point, and that led straight into that tooth. So this is a very good test. And also, when I saw the patient, I did the sensibility test, which combined with the sinus tract and the X-ray, and that's when we understand whether the other teeth are also involved in the lesion or not. The CBCT was done, and as you can see, the periradicular radiolucency is starting to go sideways towards the adjacent teeth. But when you do the sensibility test, it proves to you that those two teeth were completely normal and alive and in function. There are cases where for example, the test with the endofrost, for example, gives you a bit of a doubt whether this tooth responds to cold, responds to electric pulp test. And if you are in doubt, it's better not to do any root canal treatment on that tooth. Do the obvious one first, mainly for young patients. Otherwise, you end up removing vital pulp sometimes, so it's better not to touch it. With the obvious one in the middle of the lesion, that is the tooth in the middle of the lesion, the one which is necrotic, the one which was slightly discolored, and as you can see here, there is a little bit of pulp calcification in the middle of the tooth, which is quite normal in cases of trauma. It can be. When you do your access cavity, you need to make sure you find that. If you can't remove, if it's too hard, then make sure you go on both ends here, so on both sides of that. The other thing to notice is that there is a tiny bit of cortical bone. The tooth was slightly mobile, grade 2 mobility, and there is quite a large periradicular radiolucency. Don't be scared with those radiolucency. If it's not a true cyst, it doesn't look like, then it's going to heal after root canal treatment. In some cases where there is a true cyst, or if it's quite tricky, then it may be that an apsectomy or endodontic microsurgery is advised. But in this case, we could do, as you can see, the root canal treatment without any problem, and I could remove that calcification. There are calcifications as well on the other teeth, so it could be quite normal for that patient, so don't worry too much. It could be related to trauma as well, so pay attention if those teeth will devitalize in future. But for the time being, those teeth were vital, were normal, and we discussed with the patient and with the parents to have that treated first and to monitor the tooth to see if there would be any healing in that case. Another thing to consider, and this is very important, is to do an access cavity possibly at the same width of the canal, because what you don't want is to destroy this tooth too much. If you can do even smaller, is much better, but sometimes doing too small is difficult for you to see if there is any extra canal, or negotiate the lingual one, or even to bond composite. So a very conservative approach, but enough for you to disinfect, for you to do your root canal treatment. That's the advice. Also, make sure you go up to the apical portion. Is very important because of the size of the lesion. And after 6 months, if you do it properly, if you disinfect it properly, you won't go wrong with that. But of course, if you've done it properly and it still hasn't healed, that's when the endodontic microsurgery is advised. Or you need to check the other teeth to check if they are still vital, or if it may be that it needs a root canal treatment as well. Because if there is another tooth, another canal that is infected, that will feed the infection and that will not allow the whole area to heal. But as you can see, we were correct. It was just one tooth involved in the trauma. And after the root canal treatment, we could see a beautiful healing. This tooth is absolutely back into function and is stable, and there is no more problem to the tooth and to the patient. So pay attention on those details when you see trauma cases. And if there is any comment, any doubt, anything you want me to discuss it further, please put in the comments below and I'll be able to answer to your questions. Thank you very much and stay tuned.